Hey everyone, Dr. Jeff Pang here. Exercise therapy is one of the best ways to treat hip arthritis as well as hip pain, and people who have hip arthritis tend to also have a lot of muscle atrophy, and this leads to muscle weakness. So this exercise program is designed to hit all the major muscles in the leg to get you back to being pain-free. Let's get started. Now, if this is your first time watching one of my videos, my goal is to help each and every one of you live an active and healthy lifestyle. So if that's something you're interested in, please consider subscribing to my channel. Exercise therapy is extremely important for those who suffer from hip arthritis. Exercise therapy together with load management are by far the two most important things that you can do to improve long-term outcomes and decrease the risk of a hip replacement surgery. I've made another video going over all the other recommended treatment options for hip arthritis, which I will link here. Now, a few quick notes before we get started. You may want to first do a quick warm-up such as jumping jacks or riding a stationary bike. This is going to help get your heart rate up. It's going to help loosen your muscles. We'll then move into some strengthening exercises as well as some simple stretches. Talk to your doctor or a physical therapist if you have any pain when exercising. Okay, so the first exercise we're going to work on are half squats. Now, a half squat is just like a full squat. So a full squat, you're coming all the way down, you're letting your knees get to 90 degrees. But this can be a problem, especially for someone who has arthritis, especially in the hips or in the knees. It can actually overload the hips and the knees, and that can actually lead to more pain. So what a half squat is just going halfway. It's just like a full squat, but you're going halfway, and then you're coming back up. And what you want to do when you come down is you want to hold this for about 2 to 3 seconds. You're going to feel it in the thigh, you're going to feel it in the glutes, and then just come up. And the goal is to do 3 sets of 10 doing half squats. Now, if even doing half squats causes a lot of pain or a lot of discomfort, what you can first do is just do sit downs and stand ups. And so sit down, stand up, sit down, and stand up. And doing it this way, you're going to be building strength in your thigh muscles and your glutes. And over time, as you do get more strength, then you're going to be able to get into that half squat. And again, doing 3 sets of 10. So the next exercise we're going to work on are hamstring curls, and the hamstrings are these big thigh muscles in the back of our leg. So what I want you to do is to hold onto a chair or hold onto a wall, bend your other leg, and using the affected leg, curl it up so that your heel gets as close to your glutes as possible, and then bring it back down. And where you're going to be feeling this is in the back of your leg, so you can even hold your hand here and you should be able to feel that contraction. Hold this for 2 to 3 seconds and then bring it back down. Hold it for 2 to 3 seconds and bring it back down. What I don't want you to do is just kind of flinging your legs like this. You're not really getting a good workout like this. What you can do is slowly feel that contraction, hold for 2 to 3 seconds, and then bring it back down. And we're doing 3 sets of 10 doing it this way. Okay, so the next exercise we're going to work on are lying straight leg raises. What I want you to do is to get in a position like this, just on your elbows, and get comfortable. Now, if my right leg is my affected leg, all I'm going to do is to lift this leg up. Now I want to keep my knee straight. Hold this position for 2 to 3 seconds and then bring it back down. Bring it up, hold it for 2 to 3 seconds, and then bring it back down. And where you're going to feel it is in all your thigh muscles as well as the front of your hip. Working on strengthening all of these muscles. Now, if you can't get it this high, that's okay. As high as you can get it. If it's just right here, try to hold it for 2 to 3 seconds, and then bring it back down. And the goal is to do 3 sets of 10 of this exercise. The next exercise is going to be similar, but this time we're going to be facing down. So just like the other one, this time you're facing down just like this. Get comfortable on your elbows. Now, if my left hip is the affected leg, what I'm doing is I'm just going to slowly bring it up, holding for 2 to 3 seconds, and then bringing it back down. Hold it up. Hold it for 2 to 3 seconds, and then bring it back down. And where you're going to feel this is in the back of your pelvis. You're going to feel it in the back posterior thigh muscles. So bring it up, hold for 2 to 3 seconds, and then bring it back down. Again, if you can't get this high, just start over here, hold for 2 to 3 seconds, and then bring it back down. Okay, so the next exercise we're going to work on is lying hip abduction, or bringing your leg out to the outside. So what I want you to do is to lie on your unaffected leg. So if my left hip is the one that's in pain, I'm going to lie just like this. I'm going to straighten my left leg like this, and then bring it up towards the side. Hold for 2 to 3 seconds, and then bring it back down. We're doing 3 sets of 10. So hold for 2 to 3 seconds, bring it back down. Where you're going to feel this is all in the outside of your hip muscles, right over here. And these are part of your glutes. These are really important for pelvic stability. And these can be affected if you have hip pain, if you have hip arthritis. And so you just want to hold it up and bring it back down. Now again, if you can't get it this high, bring it as high as you can. Maybe if it's just right here, hold for a few seconds and then bring it back down. Working on 3 sets of 10. Okay, now the last exercise we're going to work on is hip adduction, or bringing our hips inwards. So this time what I want you to do is to lie on your affected leg. So if my left hip is the one that is affected, what I want to do is bring my right hip across my body just like this, in this position. Keep the left leg nice and straight. And then what you want to do is bring it inwards. And what you want to do is hold for 2 to 3 seconds, bring it back down. Hold for 2 to 3 seconds, bring it back down. And we're working on 3 sets of 10 of this exercise. So hold for 2 to 3 seconds and then bring it back down. Okay, now we're going to move on into some stretches, and the first stretch we're going to work on are the hip flexors. And so again, if my left leg is the one that is affected, what you want to do is you want to get into a kneeling position just like this. Now this can put a lot of pressure on your knee, and so what you can do is put a cushion underneath your knee, you can put a pillow underneath your knee. If you need to, you can hold onto a wall, hold onto a chair, something like that. And what you want to do is you just want to lean forward, and when you lean forward, you're going to be feeling a stretch right in the front of your pelvis, right in the hip flexor area. Now you want to hold this for initially 30 seconds and build yourself up to 1 minute. Now if you want to get a deeper stretch, you can just lean a little bit more forward and you're going to feel a stretcher here. Otherwise, you can also lean forward and then start rotating your pelvis backwards like this to open up this area and get a deeper stretch. Remember, 30 seconds, work yourself up to 1 minute. The next stretch is a seated rotation, and this is going to work on the piriformis and it's going to help work on the glutes. So what you want to do is you want to straighten your unaffected leg, and in using your affected leg, you want to bring it up and around the outside of your other knee, rotate your trunk this way, and use your elbow to push that way. And you're going to be feeling this stretch all the way down here. We're going to start at 30 seconds. Get into that stretch. If you can, build yourself up to 1 minute and hold this stretch to really stretch out this area in the back of your buttocks. The next thing we're going to work on is stretching out the glutes, and I'm going to show you 3 different ways of doing this. One's more beginner, one's more intermediate, and one's an advanced way of doing it. And just do the one that feels comfortable for you. So the first one is just a knee to chest, and what a knee to chest is just like this. Pulling the knee as high as you can up towards your chest, and where you're going to feel it is all up in the glute muscles all the way back here. The goal is to hold this for 30 seconds and work yourself up all the way up to 1 minute. Now if you want to try a little bit more advanced, this is the intermediate way, and this is a 90-90 pose. So you got 90 degrees in your leg here, 90 degrees in your leg here. And what you want to do is you want to hinge at your waist towards your opposite foot. And where you're going to feel it is all the way in the back of your glute muscles. And that's the intermediate way. Now the advanced way is a pigeon pose. So again, 90 degrees here. This time you're going to straighten your leg all the way back, and then you're just going to lean forward. Now this is one of the best and deepest ways to get that glute stretch. But for people with moderate to severe arthritis, it's really hard to get your hip in this position. So whatever works best for you, if that's knee to chest, if that's a 90-90, or if it's a pigeon pose, really important that you work on stretching out the glutes. Okay, the next stretch we're going to work on are the hamstrings. Now remember, the hamstrings are the big thigh muscles in the back of your legs. So what you want to do is to get into a position like this and hinge at your hips towards your knee just like this. And where you're going to feel it is in the back of your thigh. Now, if all you can do is start here, good, as long as you're feeling that stretch. What I don't want you to do is to arch your back like this, because then you're going to just put too much tension through your spine. So what you really want to do is hinge at the hips, feeling that stretch in the hamstrings, and then you can use your arms and try to touch your feet. And the goal is to hold this for 30 seconds, work yourself up to 1 minute, working on stretching out the hamstrings. Okay, the last stretch we're going to work on is a butterfly stretch. And so what you want to do is you want to sit like this, try to get your feet touching. Now, if this is as far as your knees go, what you can do is then lean forward, and you're going to feel a stretch in the inner thigh, right where all the pelvic muscles are. Now, if you can, try to drop your knees a little bit farther towards the ground as you lean forward just like this. Now, remember, we're going to hold this for 30 seconds, work ourselves up to 1 minute, working on the adductor muscles. This hip exercise and stretch program is designed to be done 4 times a week for 4 to 6 weeks. Once you start feeling better, you may want to continue this program once or twice a week as maintenance therapy for lifelong protection of your hips. And remember, exercise therapy is one of many treatment options that I highly recommend everyone with hip arthritis pursue. This next video will go over all the other non-surgical treatment options for hip arthritis, including all the ones that I recommend. Thanks for watching.